what exactly is a mommy makeover.
Well, now to what's becoming a popular trend among parents. They're called mommy makeovers.
Front and back for her mommy makeover.
General rule of thumb for mommy makeover recovery.
Hey everyone, it's Dr. Barrett. We have an exciting Mommy Makeover Surgery.
Some people think it's superficial, but it's much deeper than that.
Before my surgery, didn't wear bathing suits at all.
And I had stretch marks, loose skin, and I just felt deflated.
These are surgeries that you'll do once in your lifetime. Don't plan them in a rush.
Can a person get pregnant again after a mommy makeover?
So it is not that it causes any problems in the pregnancy.
How soon after pregnancy can you consider a mommy makeover?
That is a good time to go for a mommy makeover.
Can breastfeeding also affect mommy makeover or vice versa?
All the changes that we have done surgically in a mommy makeover to make the tummy flat or to lift the breast, all of that will be lost. So I sometimes have patients, who weigh hardly 40 kilos, 45 kilos, but they still look pregnant. Don't go for a mommy makeover now. Hello everyone, in today's episode, let us understand a few things about what exactly is a mommy makeover.
How soon after pregnancy can you consider a mommy makeover?
Normally, a woman loses a lot of weight post-pregnancy, and the weight loss goes on for around 3 to 6 months, sometimes up to a year. So this weight loss is very important. It's called as involution. So involution means whatever tissue has stretched out, the tummy and other areas, they shrink in size. And as I said, because this happens till the first year or year and a half, it is ideally advisable to wait till this time. Once you feel that you have maximally lost your weight and the weight has plateaued, that you are not losing any further weight, that is a good time to go for a mommy makeover. But of course, you should always plan a mommy makeover once your family is complete. These are surgeries which are to be done once in your lifetime. So you shouldn't plan it in a way where if you are down the line after a few years planning a pregnancy, don't go for a mommy makeover now. Do it after your family is complete.
Can a person get pregnant again after a mommy makeover?
It is not that a person cannot get pregnant, but then all the changes that we have done surgically in a mommy makeover to make the tummy flat or to lift the breast, all of that will be lost if there is another pregnancy. So ideally, it shouldn't be a scenario where someone has a pregnancy after a mommy makeover. But having said that, mommy makeover itself has no altercation in pregnancy. All of my patients who have had pregnancies after their mommy makeover, they had normal pregnancy, they did very well. So it is not that it causes any problems in the pregnancy, just that your skin will again become loose.
And what are the non-surgical options for a mommy makeover? Like, are there any lasers or injectables for that?
No, there are really no non-surgical alternatives for a mommy makeover, because a mommy makeover entails getting back into a pre-pregnancy kind of a shape, and there are really no injections or non-surgical treatments which can do that. A mommy makeover essentially is to get rid of the excess bulges. It is to tighten the tummy by tightening the muscles and removing the extra flab of skin that happens post-pregnancy. Then it involves surgeries on the breast where there is lifting of the breast if required, or reshaping of the breast tissues. We can also combine it with aesthetic genital surgeries such as tightening of the vagina or labiaplasty. So all of these are surgical procedures. I don't think there is anything non-surgically that we can offer in a mommy makeover.
So, do we need to lose weight before a mommy makeover surgery?
Yes, always. Whenever someone is contemplating any kind of body contouring surgery, it should always be done when you are at your leanest. What it means is, if you are doing weight loss, wait till you will reach a point where your weight will plateau and you will feel that you are just not able to lose further. That is the ideal time to plan any kind of body contouring surgery, including a mommy makeover. Don't do it at a time when you're still having weight loss, because if you do a surgery and then you have further weight loss, the skin can again lose its tone, it can again become loose.
And what are the psychological benefits of a mommy makeover?
Oh, tremendous. Amongst all the surgeries that we perform at our center, I always say that a tummy tuck and a breast lift are two surgeries which are life changing for a woman. I see patients whose attire, the way they dress, the way their confidence is, it completely changes after a mommy makeover. So these are really life transforming surgeries. No two ways about it.
So, can a mommy makeover help with the loose or separated abdominal muscles as well?
For sure, the separation of abdominal muscles is called as divarication of rectus muscle. So the rectus muscle is a pair of muscles, one on each side on the tummy, and these two muscles are joined to each other in the midline. Now during pregnancy, what happens? The muscle stretches out so much that there is a gap which is created between the two muscle edges. Now post pregnancy, though a woman may lose the fat, the muscles still remain apart, and there is a weakness which is created between the two muscle bellies. This is called as divarication of the rectus. So during a tummy tuck, there is a step in which we reposition the muscle back to the midline, and that is the repair of this kind of weakness of the muscle. So I sometimes have patients, who weigh hardly 40 kilos, 45 kilos, but they still look pregnant. That shape of the tummy is not because of fat, it is because the muscle has given way or it has just lost its tone, and therefore sometimes surgery is the only way to get back into shape and get a proper toned tummy. After the surgery, of course, you can maintain it by doing your normal activities, exercise and workout.
And what role does a PCOS or thyroid plays in, mommy makeover planning?
Yeah. So thyroid hormone is something which controls our metabolism, and if you are someone who has hypothyroidism or low thyroid, it makes you gain weight very fast, and also it slows down your calorie burning capabilities. So you need to work out more to get into a better shape. PCOS is polycystic ovarian disease that again sometimes causes too much of hormonal issues in the body, and that again leads to weight gain or weight fluctuations. So it is almost always imperative to bring your hormones under control before any kind of surgery, and only when your hormones are in a normal level, then you can go for a surgery. But of course, removing fat from the body is a very important thing in getting your hormones under control. I have so many patients who are obese, who have PCOS or who have thyroid issues, and I find that post their liposuction or post their mommy makeover, their hormones are in much better shape than what they were before. So it does help, yeah.
Can breastfeeding also affect mommy makeover or vice versa?
So normally we don't recommend any surgery when the woman is still breastfeeding, for the simple reason that whatever medicines or antibiotics the patient is going to take will get passed on through to her baby, and therefore ideally we don't do any kind of surgeries till the breastfeeding period is over. And also because breastfeeding also causes weight loss, because women lose a lot of calories when they breastfeed their child. So it is always better to finish the breastfeeding period and then plan the surgery.
And can mommy makeover address a pregnancy stretch marks as well?
Yeah, yeah. So the stretch marks which are in the lower part of the belly, those can get removed during a mommy makeover, because we incorporate the lower part of the tummy in the contouring of the tummy. But if you are someone who has stretch marks in the upper part or above the navel, those stretch marks are not completely gone, but they get shifted to a lower part which is less visible. Lower stretch marks below the navel are almost completely gone.
Sure.
So, if you are someone who is contemplating getting back into your pre-pregnancy shape, which is called as a mommy makeover, well, these surgeries are very safe. Each surgery can be customized to match your requirement, whether it is for the tummy or for the breast or other areas of the body. Of course, as I said, take your time. Wait till you finish your breastfeeding period, because it will give you a lot of weight loss by the end of that 1 year, 1.5 year period, and then plan your surgeries. Don't plan them in a rush, because these are surgeries that you'll do once in your lifetime. These surgeries with a downtime of around 2 weeks to 3 weeks. So plan the surgeries in a way where you can take some rest after the surgery for adequate healing. Don't do it at a time when you're too much rushed or you're under too much of work pressure. When you plan the surgeries properly, taking into account something like a recovery period, then these surgeries can give you a very good effect. The only aftercare involves wearing an abdominal binder or a belt for 4 to 6 weeks and a sports bra for around the same period. Once you follow the instructions given by your plastic surgeon to the T, these surgeries can be very, very effective in giving you what you desire. So think about what all are the aspects of your life that you're dealing with, plan them properly, and then plan a mommy makeover.